Hey guys, this is Regina from www.remarreview.com. Are you ready to go over some NCLEX questions? If so, we're about to get started. Now, if ever you want to answer the questions before I say it, just hit pause on the video, write down your answers, and then continue with me when you're ready to know whether you got it right or wrong. So we're going to get right into it. Question number 1 says, a nurse is reporting to duty and she has 4 patients who are requesting pain medication. Which client is most at risk for depressed respirations due to narcotic intake? A 15-year-old male client with multiple fractures in his leg after a football accident. B, a 23-year-old male heroin addict whose last hospital visit was due to a drug overdose. C, a 79-year-old female who has been newly diagnosed with Hodgkin's lymphoma. Or D, a 17-year-old female with chronic sarcoidosis. Out of all these patients, the one most at risk for respiratory depression is going to be the 17-year-old female with sarcoidosis. That is a respiratory disease which will make her most at risk for respiratory depression due to narcotics. Question 2. A client has been newly diagnosed with left side eye blindness. The nurse should promote independence by placing items on which side of the patient? A, left, B, right, C, overhead, or D, hiding items, then asking patient to find them. The correct answer is the right side. This will promote independence in that patient. Also remember, if you have a patient who is blind, do not shout when teaching or entering the room. Question number 3. The nurse plans care for a 36-year-old woman with Graves' disease. The nurse knows that which of the following foods or fluids should be restricted for this client? A, ice cream, B, tea, C, oranges, or D, pasta. If I had a patient with Graves' disease, I would not want them to have the tea because it stimulates. Let's move on. Question number 4. A nurse is caring for a client who has just received a right eye donation from a recently deceased donor 3 hours ago. The nurse will implement the following actions except A, changing the eye dressing if it becomes visibly soiled. B, monitoring the vital signs and orienting the client. C, positioning the client to reduce intraocular pressure. Or D, teaching patient not to rub the eye. Of all these things, you would not implement the changing the dressing. This is a new surgical dressing site. The doctors will want to be the first ones to change it. This is the safest thing that you can do for your client. Question number 5. The primary way hepatitis A is spread is by which route? A, sexual intercourse. B, contact with infected body secretions. C, through fecal contamination of food or water. D, through kissing. That involves contact with mucous membrane. I know from studying that hepatitis A is spread through fecal contamination of food or water. You definitely have to know the transmissions for A, B, C, and D when it comes to hepatitis. How are you guys doing on this exam so far? Let's continue on. 6. A nurse receives a bag of 10% dextrose from the pharmacy, but the bag is not labeled. What is the initial action of the nurse? A, contact the pharmacy to let them know the error. B, hang the bag and administer to the client. C, send the bag back to pharmacy. Or D, contact the unit supervisor. Remember, for NCLEX is all about safety. So the safest thing for the nurse to do here is contact the pharmacy to let them know the error first before you send the bag back to the pharmacy. All right, let's keep going. 7. Immediately after a percutaneous liver biopsy, the nurse should place the client in which of the following positions? A, supine. B, right side lying. C, left side lying. Or D, semifallers. You guys should definitely know the steps of a liver biopsy, and one of the important things is the positioning, not only after, but before. But I know that afterwards, because the liver is on the right side of the body, the patient should be put on the right side lying position to help put pressure on the liver so that it doesn't bleed out. Okay, let's move on. 8. Nursing administration has received a formal complaint about a nurse who is physically abusing elderly patients on the unit. The most appropriate action for the administration to do is which of the following? A. Notify the authorities. B. Notify the Board of Nursing. C. Notify and file a complaint with the hospital's legal team. Or D. Write an incident report. When it comes to reporting errors, it is the responsibility of the nursing administration to notify the Board of Nursing when a formal complaint has been filed against the nurse. Okay. Let's move on. Question number 9. An elderly client has fallen out of a 10th floor window and died during the night shift. The nurse caring for the client has to write an incident report. The nurse should do which of the following? Select all that apply. A. Report to the nurse manager. B. Place a copy in the client's chart. C. Report patient's actions and unhappiness with care. D. Record opinion of physician. Filling out an incident report is a fundamental skill of nursing. You have to know that in this situation, the nurse should do A. Report to the nurse manager, and C. Report patient's actions and unhappiness with care. Incidents report should never be put in the client's chart, and you do not want to include opinions of physicians or nurses in an incident report. You want to keep the information factual and straight to the point. Last question. A client is admitted to the medical surgical unit. The nurse sees the client is suspected to have smallpox. Which of the following isolation precautions should be implemented? A. Universal. B. Contact. C. Droplet. D. Respiratory. The correct isolation precaution when a patient has smallpox is respiratory. You guys have to know your isolation precautions in order to pass NCLEX. Well, these were just a few of the questions from the NCLEX Ready exam in the online academy. If you would like to continue studying with Remar Review, it's so simple for you to get started. Just go to the website www.remarreview.com. Pick the product that you're interested in and start getting this information right away. Thank you guys for studying with me. Bye-bye.